Hello everyone, this is Dr. Ananth Chintapalli, Consultant ENT and Skull Base Surgeon, Star Hospitals, Banjara Hills, Hyderabad. Swimmer's ear is a common term which is given to a more the more technical term to it is called otitis externa. Swimmer's ear is said swimmer's ear because for the reason it is more seen in individuals who swim quite often or who get exposed to contaminated waters, especially pond waters or rivers or contaminated swimming pools. The otitis externa, which is more technical term for swimmer's ear, is the infection of the ear canal which is visible externally. So if the skin in the external ear canal gets infected, probably because of the contaminated water which enters into the ear during swimming, will cause this condition known as swimmer's ear. Now, what exactly happens in a swimmer's ear? So the skin gets infected and causes, because the space inside the ear canal being narrow naturally, and the skin being more tautly adhered to the underlying bone, there is less of soft tissue. So any inflammation causes stretch in the skin and causes severe pain. Now any pain, especially after being exposed to these kind of waters, if persisting beyond a certain period of time, probably a couple of days or more, and associated with certain clinical features such as excruciating pain, not necessarily excruciating pain, can also be a dull pain, but which is persistent and progressive, and associated any ear discharge, can be watery ear discharge or purulent, that is pus associated ear discharge, with or without any malodor, that is a characteristic smell of that discharge, can be fishy in smell or can be fetid or sometimes be pungent. So if these kind of symptoms arise, or if the condition progresses beyond a certain period of time, giving rise to these symptoms, then it is advisable and strongly recommended that individuals get their ears checked by an ENT surgeon. Now, what happens if this is not checked or treated promptly? Now, there is a spin-off to this relatively simpler condition. Now, if this condition persists beyond a period of time, and especially in immunocompromised individuals like in diabetics or people who are taking under certain medical treatments which purposefully are targeted to reduce the immunity of that patient, if swimmer's ear, that is otitis externa, persists in such kind of an individuals, especially diabetics, it can lead to a more graver, more serious condition known as malignant otitis externa or skull base osteomyelitis. That is, the skull base is the thin plate of bone which is underlying the surface of the brain and supporting the brain. So if this ear infections, which can easily spread to much more deeper portions of the skull, especially in immunocompromised patients, and they can end up in skull base osteomyelitis, which is life threatening. So it is very important that these cases, these conditions are picked up promptly and treated adequately.